mynews.studio.
4 out of every 10 cancer cases worldwide could be prevented. So why aren't we seeing bigger declines in cancer rates?
Today's date is 2026-02-10. A new study from the WHO and IARC says about 37% of new cancer cases are linked to risk factors we can actually change. At 7.1 million people each year. If the facts are this clear, what's stopping broader progress?
Let's look closer at those risk factors. Tobacco is by far the biggest, responsible for 15% of all new cases. That's more than 3 million people. Infections come next at around 10%, then alcohol at 3%. But these numbers shift depending on the region and gender. In East Asia, for instance, smoking and alcohol play such a big role that over half of cancers there could be prevented. Why do you think that region stands out so much?
It's a combination of culture and policy. East Asian countries have a history of higher smoking rates, especially among men. According to WHO data, in East Asia, 57% of cancers could be prevented, mainly by cutting tobacco use. Meanwhile, in sub-Saharan Africa, infections like HPV and hepatitis are the main drivers, especially for women. There, 38% of cases could be prevented. So would you say the best prevention strategy really depends on where you live?
Yes, exactly. In East Asia, policies like tobacco taxes and smoking bans are effective. In Africa, expanding HPV and hepatitis vaccinations makes the biggest difference. But here's what I wonder. Is it mainly a funding issue, or is it more about political will and public understanding?
It's both. The WHO points out that tobacco control and vaccination programs are actually cost-effective, even for countries with smaller budgets. For example, vaccinating school-aged girls against HPV dramatically reduces cervical cancer rates, and tobacco taxes can cut lung cancer without huge infrastructure.
Some countries are taking action, but progress isn't even. There's pushback from industry, and sometimes cultural resistance to vaccines or smoking bans. Plus, healthcare access is a barrier, especially for early detection. But the evidence is strong. Prevention and early diagnosis work. In the US, England, and Wales, for example, survival rates have doubled since the 1970s. Right now, 70% of people diagnosed with cancer survive at least 5 years. How did those countries make that happen?
The main drivers were cutting smoking rates, improving screening, and new treatments, things like immunotherapies and targeted drugs. In the US alone, these changes have prevented almost 5 million cancer deaths since 1991. Even for advanced cases, survival has improved from 17% to 35%. But is it realistic for countries with fewer resources to see the same gains?
That's the big question. Some strategies scale well, like mobile screening clinics or weaving vaccination into existing health programs. There are also lower-cost steps, like reducing pollution or encouraging physical activity. The report says it's about focusing on what's most effective in each setting. For instance, is it better to start with tobacco control or with vaccination campaigns?
Where tobacco is the biggest risk, like East Asia or Eastern Europe, tobacco control gets results fastest. In places where infections are the main cause, much of Africa, for example, vaccination is key. But there's also a bigger picture, sharing research, technology, and best practices globally. Do you think new cancer therapies might end up making the gap wider between wealthier and poorer countries?
That's a real risk. Access to newer treatments like immunotherapies is still limited outside high-income countries. That's why prevention and early detection are so crucial. They're more accessible, and they save more lives right away. Still, the survival gains in places like the US and UK show what's possible when investment and innovation come together. Are those lessons being used elsewhere?
Some countries are testing remote screening or adapting protocols to fit their needs. There's definite interest, but scaling up is the challenge. The WHO is pushing for policies that match each region's unique risks and resources. Ultimately, the main takeaway is that cancer isn't just an ongoing crisis, it's a burden we could cut dramatically, starting now. The tools exist. The question is whether policymakers will actually use them.
That's where it stands. We know what works and what's at stake. Millions of lives, billions in healthcare savings. Prevention, early detection, and policies tailored to each region are key.
To sum up, 4 in 10 cancer cases can be prevented globally. Survival rates have doubled in some countries, and the way forward is clear. Add on tobacco, infections, and early diagnosis.
Thanks for joining us. Knowing is the first step, but action is what really saves lives.
Thank you for listening. This episode was powered by mynews.studio. Try it free today.